Muscle cramps are something almost everyone experiences at some point in life. They can be painful, sudden, and disruptive. But how do you know when a muscle cramp is just a harmless inconvenience and when it's actually a warning sign of a more serious health problem? That's exactly what we're exploring today. In this video, I'll walk you through the key warning signs that muscle cramps might not be normal, explain the symptoms you should never ignore, and give you clear advice on when it's crucial to see a healthcare professional. Understanding this could make all the difference for your health and well-being. Understanding the warning sign. Most muscle cramps happen because of minor causes: dehydration, overuse, mineral deficiencies, or sitting in an awkward position. However, there are important red flags that suggest your cramps may stem from an underlying medical condition that requires urgent attention. Here are some of the main warning signs. Frequency and duration. If your cramps happen very often, multiple times a day or several times a week, and they last much longer than usual, over several minutes or hours, this could be a sign that something is wrong beyond simple muscle fatigue. Pain, severity, and impact. If cramps cause severe, debilitating pain that doesn't improve with typical home remedies, or if the muscle remains tender or weak afterward, it's worth investigating further. Neurological symptoms. Numbness, tingling, or weakness in the area of the cramp can indicate nerve involvement. This could be caused by nerve compression, neuropathy, or even neurological disorders. Swelling, redness, or warmth. Signs of inflammation or infection such as swelling, redness, or heat in the affected muscle need prompt evaluation. Systemic symptoms. If muscle cramps occur alongside unexplained weight loss, fatigue, fever, or night sweats, these may be warning signs of systemic illness like autoimmune disease or cancer. If any of these red flags apply to you, don't dismiss your symptoms. Early detection of serious conditions improves outcomes. Muscle cramps accompanied by other symptoms. What to watch for. Sometimes muscle cramps are not isolated, but part of a bigger clinical picture. Here are common scenarios where cramps might signal serious disease. Lower back pain and radiating leg cramps. This may suggest a herniated disc pressing on spinal nerves, causing sciatica. The pain often radiates down the leg, sometimes with numbness or weakness. Muscle weakness or paralysis. Muscle cramps coupled with weakness, difficulty moving the affected limb, or muscle wasting need immediate medical evaluation. These signs can point to neurological diseases like multiple sclerosis, motor neuron disease, or peripheral neuropathy. Changes in skin color or swelling. Cramps with leg swelling, bluish or pale skin, or warmth can indicate vast chest pain or shortness of breath with leg cramps. Sudden onset of leg cramps accompanied by chest discomfort, difficulty breathing, or rapid heartbeat may signal pulmonary embolism. Blood clot in lungs, which is a medical emergency. Cramps with electrolyte imbalance. Symptoms: severe cramps along with muscle twitching, palpitations, confusion, or seizures might indicate dangerous imbalances in potassium, calcium, or magnesium levels. If you experience cramps alongside any of these symptoms, seek emergency medical care immediately when and why you should see a specialist. Many muscle cramps can be managed with lifestyle changes and simple treatments, but certain situations demand professional assessment. Persistent or recurrent cramps. If cramps don't resolve with hydration, diet adjustment, or rest and care, accompanied by neurological or circulatory symptoms. As mentioned, symptoms like numbness, weakness, swelling, or skin changes mean you need a thorough neurological or vascular workup. Sudden onset in older adults. New unexplained cramps appearing suddenly in older adults may reflect serious conditions such as peripheral artery disease or electrolyte imbalances. Known chronic illness. If you have diabetes, kidney disease, or other chronic illnesses, cramps might indicate complications requiring specialized care. When visiting your doctor, be ready to provide detailed information about your cramps, how often they occur, duration, intensity, specific location, and whether they spread. Any associated symptoms like numbness or swelling, your medical history and medications. Your doctor may recommend tests such as blood work, nerve conduction studies, imaging scans, or a referral to a neurologist or vascular specialist to find the underlying cause. Muscle cramps, while common, should never be ignored if they show warning signs or interfere with your daily life. By paying attention to frequency, severity, and accompanying symptoms, you can differentiate between harmless cramps and those signaling a serious health issue. Early medical consultation can not only relieve your symptoms, but also prevent complications from underlying diseases. Taking care of your hydration, nutrition, regular exercise, and avoiding overexertion are important preventive steps. But when cramps are severe or accompanied by other troubling signs, seeing a healthcare professional is essential. This video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. If you experience severe symptoms or have concerns about your health, please consult your doctor or qualified healthcare provider immediately. Thank you for watching. If you found this video helpful, please like, subscribe, and share. Leave your questions or experiences with muscle cramps in the comments below. I'd love to hear from you. Stay healthy and take care.